We've been seeing a lot been talked about Indian healthcare, and also the numbers, as Dr. Karanjekar just mentioned, is huge. The volume is what drives business in India. We are the fastest growing economy today. But I think the gap between Bharat and India is narrowing, and narrowing very rapidly. And that's where actually your opportunity lies. So I'm not Bharat nor India. I think that the gap will close, and that gap is what the opportunity is all about. I'm going to talk more in terms of infrastructure, for healthcare in India. I will also try to rake up the challenges, as Viveka has said, and also try and line up some opportunities as we proceed. To understand healthcare in India, you need to have some figures and indicators. You must have had those through UKTI, but just to repeat it, India today has 1 bed per 1,000 population. We need to reach 3 per 1,000. That itself shows you the kind of gap which exists in the infrastructure. Alright? And like Dr. Karanjekar said, maximum number of beds lie in the public sector, where Bharat, as the so-called Bharat, takes its healthcare. Now this gap itself, is huge, and we are not able to bridge it to the extent that we perhaps need to add maybe 1 million beds over the next whatever number of years, and we hardly add thousands. Okay, so these opportunities are not going to go. With this, we have also to look at that when you are talking of 1 bed, the investment levels in India, if at one end if you take the public health infrastructure, it might cost you maybe about 3 million. Yeah. 3 million, and it might go to the other end to 10 million when you talk of corporate hospitals like Global or Apollo's or the Fortis. So that's the kind of investment which is required. We've had almost about, I think, 48 private equity funds which invested in Indian healthcare last year. India's healthcare grows today at almost 13%, which is pretty much good growth. Having said all this, then where is the problem? We seem to be a nation which can take a lot of healthcare. But the issue is the return on investment is not as high as perceived by the outside world. So we at a level get investment return maybe at an EBITDA basis 18 to 25%, on a PAT basis maybe 8 to 10%, and that's why where we have these kind of problems that come up. Though it's still very early days for the returns on private equity, but there have been certain deals which are showing interest in healthcare in India, and I think it will continue to grow. Yes, we have a problem, and a complete dichotomy between the public sector infrastructure and the private sector infrastructure. It's not like the NHS, in the UK, where the infrastructure qualitativeness is not very different than a private sector hospital. In our case, it's almost 180 degrees, difference. If you see some of the hospitals, you will realize what I'm trying to say. Whatever the government tries and does, it's never going to bridge that gap. All right. So that will keep on existing. Coming to some of the challenges as you would set up business in India, and I think the most important and the most challenging for you will be India is a cost sensitive market. Whatever you try and do, people will look at the value for money kind of a situation, and that is where I think most of these companies are not able to set up bases in India. You need to realize that India is volume, alright? India is not so much about margin. That margin will come with the volume. So people who are willing to do that, I think there is big opportunity in India. The other problem and challenge that India faces today is human resource, to cater to this healthcare. Just like I said, 1 bed per 1,000 population, I think India generates about 36,000 doctors per annum. And going by the numbers, we need to double it. So that means if we have about 300 odd medical colleges today in the country, we need to double it. Okay? Doubling it comes at a cost. Alright, so that cost would be almost maybe 30 million, 40 million Indian rupees to set up one such educational institutions you could have opportunities in that sense in form of a PPP, format where you could have NHS or any other educational institution which gives education as well as facilities for treatment could look at some of these. There are some very good institutions which have done this. The first name that comes in the mind is Christian Medical College in Vellore. We had the opportunity to do a strategic growth plan and we continue to work with them. I think that's the kind of institution which could perhaps be grown through a PPP effort. Like Mr. Karanjekar, Dr. Karanjekar was saying, this institution is in a small little town in state of Tamil Nadu, and it does 6,500 outpatients a day. All right. I remember once, taking some architects from United States with whom we have collaborated to do a design master plan exercise for a new campus. And when they went and saw the hospital and saw the volume, and the next day we actually happened to be in All India Institute of Medical Sciences in New Delhi, where the number was 10,000 per day. All right, and both of those colleagues of ours who came from the United States said that this is a very difficult problem for us to first understand that how do you manage this kind of volume. So this is another opportunity, challenge as well as opportunity. Where you could there was I think a company which is into engineering consulting. So there's a big opportunity there. One challenge India has, of course, is which has been mentioned by Dr. Das also, is to do with quality and accreditation. We're still not there. Right? We have a fair amount of infrastructure. Like say city of Bombay, you want to set up a nursing home. I don't think there is a very stringent norm to that. Though now I think the government is tightening it, and doctors are not liking it in terms of fire norms or whichever way you look at it. But I think we are on the way. It will take us maybe a decade to reach where the other countries with the more regularized healthcare is. But we are there. There would be opportunities in that area also. Joint Commission International of the United States has already started that, doing business in India. There will be others who would do that. Where would be some of your opportunities? I think private equity is welcome. All right. Biomedical pharmacology. Okay. India today imports almost 80% of its content in terms of biomedical consumables, disposables. So there's a big opportunity to tie up for that. Training and education, again big. We also need, by the way, double the number or triple the number of nurses than what we have today. All right. So and we generally go with a very structured format of general nursing and BSc nursing. But we could look at opportunities where you could tie up for specialty training. What I'm trying to say, the emergency care, neonatal care, geriatric care, infection control. These things are pretty much new to India, and there is a big opportunity in those areas if you want to collaborate with some of the hospital chains or educational institutions. Hospital administration and management itself, is a big gap in the country. We need more managers, we need more trained staff. So management education programs, executive development programs, you could tie up with existing universities, university programs. Of late, say in the past about 5 years, I would say, there has been a plethora of small format healthcare providers in India, and that would be diagnostic chains, that would be day surgery centers, IVF centers, there are eye clinics, and when I'm talking these numbers, I think in past 5 years we've had about 1,000 or 500 odd eye clinics just, coming up and doing fairly good business. There are also certain companies I read, in the kit, who are dealing with information selling, IT, based kind of technology. So there can be something like a health ATM, where there are companies now who are dealing with primary healthcare in that manner, going on a subscription-based model. So these chains are, I think, a future. Diabetes is another one. I think there is a diabetes chain already in Bombay, which has a tie-up with a UK-based company. Other thing, where I think is a big opportunity is the business that Viveka is in, is media and publication. All right, there's nothing. There are hardly about 2 or 3 magazines or newspapers which are there. Very little research-based intellectual data which is available to you. You will find that out if you try to mine data on healthcare in India. It's not available that very easily. So there could be big opportunity in that, both electronic as well as publishing media. And last but not the least, I think is insurance and public health.